The only thing going around this time of year, healthcare professionals are seeing an uptick in viral infections during the holiday season. Colorado already seeing high levels of cases. Joining us right now, Dr. Olukemi Akinrinola with Advent Health. Good to see you again. Thank you so much for joining us.
Thank you for having me.
Yeah, of course. We are entering, of course, the peak respiratory season. What are the most common cases that you are seeing so far?
Absolutely. This is the season. We have about 70 to 80% of the kids we're seeing are having the viral respiratory illnesses. We're seeing a lot of the flu, influenza. We're seeing RSV infections. We're seeing the common cold and some COVID-19, and then some of the strep illnesses. But we're seeing a lot of that. It's not uncommon because
Right.
this is the season.
Right.
But just what we're noticing is that how fast the kids are getting sick.
So the big four, as we talked about, the cold, flu, RSV, and COVID. So what are the biggest differences amongst those four?
Okay, so the common cold, you have a kid that's having some runny nose, maybe some cough, a bit of congestion, maybe no fever, running around and still playing. So that's the common cold. They could feel tired, but they bounce back very fast. Then you have the flu. That is very dramatic. You're seeing a kid that is having high fever, chills, body aches. Maybe they were good in the morning, but they're now laying down. So those are the kids that are very sick. They get very sick very fast, and sometimes they may be throwing up and some strange symptoms, like for the older kids, they may have hallucinations and things like that.
Yeah.
That's the influenza flu. And then we have the COVID-19. COVID-19 can go either way. Sometimes they have the mild respiratory symptoms or GI symptoms, but the efficient thing about COVID-19 is how fast it spreads around. Then you have the RSV. That's for the babies. And I always tell parents, think of our runny nose, copious runny nose, like a faucet.
Okay.
And then having respiratory problems, breathing difficulties.
Yeah.
That's the RSV.
Yeah.
So they all overlap, but
Yeah.
the way they present are still different.
Yeah. Before the break, we were talking about vaccines, a lot of
Yeah.
concerns about vaccines. What do you want to say to people who continue to be worried about vaccines?
I mean, I believe that parents want to do the best for their kids, and so that's why the questions arise. But we know for sure that vaccines are still the most effective way of preventing some of these illnesses, especially for the flu and then the RSV. If you have a kid that is vaccinated with the flu and still gets ill, the kid may present like a child with common cold. Would not be the kids we're sending to the hospitals, and they're not the ones having the pneumonias, oxygen supplementation. So we know that vaccines work. The RSV vaccine as well, we're seeing that less babies are having it because parents that were pregnant have been getting the RSV vaccine, and it has helped a bit. So we know that